Hi, my name is Josie, and this is my model, Allison. And so for this case, I would obviously like to look at the cervical, the thoracic, the shoulder, and the scapula as all different parts as they're connected and to see where the root cause is coming from. However, with this case, I think that there is a lack of mobility in the shoulders that he is compensating with. That's causing and referring pain into his neck. And so I would like to, for this video, I'm specifically going to be looking at the shoulder joint. So be looking at the posterior glide and inferior glide. Although external rotation is an anterior glide, as just normal humans, we're more rounded. And so if I do an anterior glide, I'm just shoving it forward. So I'm going to be specific in just looking at the posterior and the inferior. And then I'm also going to look at her scapula movement to see how it is moving just on the rib cage. Hi, Allison. My name is Josie. And I just, with all your pain and what's going on, I really would like to check your shoulder. I think it could be a cause of your pain. So I want to see how it is moving, and I'll let you know what I find, okay?
Okay.
Okay. All right. I'm going to bring you here. You're just going to hold on to me right here, bringing her into open pack position and adding a slight distraction force here. How are you doing here?
Fine.
Okay. Then I'm going to come and find her joint line here. And once I find it, get on the very edge of it, and I'm just going to lean over top as I'm still distracting, centralizing her humerus into the socket, and then adding a posterior glide, nice and easy. You okay? Okay. Feeling where the restriction is. And then I'm going to do an inferior glide assessment. So still here, bringing in the distraction force, coming on the joint line here, and pushing it down. How are you doing?
Fine.
Okay. All right, so looks like I did find some. It is really tight in your posterior, what we call the capsule. The back part of your shoulder is a bit tight, and so it's hard for it to glide back. So when we're up and swinging our golf club back and you have that shoulder pain, it could be a reason why, because you're just really tight back there.
Okay.
Okay, now I'm going to check your scapula and see how it's moving. So if you could roll into your right side. Just going to scoot here. Okay. You okay in this position?
Yep.
Okay. So here I have her scapula, and then I'm just going to use my body and see how it is with retraction, protraction, depression, and elevation. And then you can do an upward rotation, bringing her up, and also a downward rotation. Okay, Allison, you can roll back. So it looks like there is a bit, just a bit an unusual movement of the scapula when you're upward rotation, it's not moving as smoothly as we would like it to. So that's something that we can definitely work on to have that motor control as our shoulders going up, making sure our scapula is following. Okay?
Okay.
Awesome. Good job.